I decided I would try to figure it out. So in those days, 16, 17 years ago, no one would make an estrogen cream. So I knew that looking at the rhythm in an endocrinology book, I would have to escalate and descend the dosing.
Right.
So there were only patches, there were only pills. I tried patches, I would cut them up. I was wearing like 23 patches to get the dose to go up, and then I'd get a blood test, see if I could bring it down. And just as I seemed to get that right, and I was allergic to the glue, but just as I seemed to get that right, I found someone who'd make me a cream. So I started all over again, working on blood levels. So working on myself and figuring out blood levels for both estrogen and progesterone, I made what we know as the Wiley protocol.
Right. In this matter, we are very similar. Everything we want to try on ourselves before we offer it.
It's called N of 1 in science,
exactly.
or test monkey, depending on how you look at it. But I tried it on me first, and I got the dosing right. And then other women who I talked to said, well, let me try. One was a nurse practitioner I knew, and one was a doctor, and one was... So they tried it, and it was all the same. It all worked the same way.
Right.
And then I wrote it all up in Sex, Lies, and Menopause. And I thought that women would take the book to their doctor would order it, pharmacy may be great.
Right.
That's not what happened. What happened was they took the book to the doctor said no. And if the doctor ordered it, the pharmacy made whatever they wanted, which didn't work. So I had to get involved at every step, and it's been 15, 16 years.
از لحظه‌ای که این نظریه شروع شد در سوزی عزیز، این تقریبا 15-16 سال پیش بود که اینطوری که مطرح کردن هیچ داروخانه‌ای، اونهایی که کامپاوند فارماسی یا داروخانه‌ای که ترکیبات کرم‌های استروژنی رو میکنن حاضر نبودن برای ایشون اینو به حالت کرم درست کنن. و خب به طرق مختلف سعی می‌کردن از پچ‌هایی که بود استفاده کنن و اینا رو در طی دوره روزهای ماه دوستای مختلف چند تا پچ بزنه، هی اینو زیاد کنه به تدریج، بعد کم کنه، در واقع مچ کنه اون سایکل، اون پریودی که در ما از چه روزی لول اون سطح استروژن و پروژسترون بالا پایین میره، به وسیله اون پچ‌ها و مقدار اونها اینو جابجا کنن تا ببینن اون علائم هات فلش و گرد گرفتگی و علائم دیگه از بین میره. و که این ترای کردن این مسئله رو چند تا از دوستای دیگهشون که نرس پرکتیشنر بودن و پزشک بودن، اونها هم در خودشون این مسئله رو آزمایش کردن که بعدم کتابی که Sex, Lies and Menopause دست بوک، اگر دوستانی که میخوان این کتاب رو بگیرن، نوشته T.S. وایلی تهیه کنن که تمام این توضیحاتی که ما میگیم جز به جز در این کتاب که چطور شد در اختیار شما عزیزان قرار میده. Okay, and then after 15-16 years, finally...
After 15 or 16 years, I went to work at a compounding pharmacy to see what they were making. Because in that book, I put their phone number. So I could sit there, and as women read the book, they'd call in. And I could find out how they were doing. And I was so shocked at how incompetent compounding was, how irregular, how they make anything they want, say anything they want, charge anything they want. And it was never the same. No control, no same every time. Well, I wanted to study my idea. And you can't study it if there are too many variables. So when I said to the compounder, we're going to standardize this, we're going to use methods, materials, pricing, packaging, everything the same. He said no. So I left. And I found compounders who would, and we have 75 pharmacies now on 4 continents.
Right. Wow. همطور که ایشون مطرح میکردن که وقتی که شروع کردن با این داروخانه هایی که ترکیبات کرمی رو درست میکنن، هیچ استانداردی نبود. هر کدوم برای خودشون روش خاصی داشتن، چی رو ترکیب کنن، با چی ترکیب کنن، چقدر قیمت بزنن، چه توصیه ها و صحبت هایی که اصلا اساس و بک‌گراند علمی نداشت به مشتریاشون بدن که این مسئله برای سوزی قابل قبول نبود. و بالاخره تونستن با داروخانه هایی با متخصصین داروسازی که حاضرن با ایشون همکاری کنن که بتونن این آیدیا رو، این نظریه رو واقعا استانداردش کنن، با که هر چیزی روی اصول خودش باشه، از چه موادی تهیه بشه، دوزش چقدر باشه، بر اساس افراد مختلف چجوری نسخه بشه که باید هم تحت نظر پزشکان باشه و به وسیله آزمایش خونی که every 3 months they do blood test, right?
We start out without a baseline if you're over 40. If you're under 40, we get a baseline. And then the first 3 months and the next 3 months, we get blood work. But once you're stable, you can do blood work once a year, twice a year.
برای اونهایی که مثلا شروع این پروتکل هستن، یکی هر 3 ماه برای 2 تا 3 ماه این کارو میکنن که وقتی که بدن به یه حالت استیبل ثابتی در اومد، بعد سالی 1 بار فقط میتونن اون آزمایش خون رو بدن، به خاطر اینکه مانیتور کنن سطح لول هورمونی رو در بدن که همه چی با اساس طبیعی و اون ریتمش پیش بره. در حال حاضر بیشتر از 75 داروخانه و پزشک متخصص داروسازی سراسر دنیا با ایشون همکاری دارن که بر اساس استاندارد کافی اینها تهیه و تحت پوشش قرار میده اون افرادی که واقعا علاقه‌مندن از این مواد استفاده کنن.
The important part about the blood testing is that we look on day 12 and 21 on the peaks of a menstrual cycle to make sure you have enough hormone to be 20 years old inside.
Wow. Yeah, I remember because the first time when I started to take these hormones, because I'm not exceptional with any other woman with all the stressful lives and everything, that my hormones was imbalances. And when I started the protocol, I remember it was day 20, 21, I had to do the blood test. And I would instantly see the differences, believe me. Otherwise, I wouldn't sit here today and talk about this. And you'll feel the difference. And
if you feel 20 inside, you sleep better.
Exactly.
You're happier.
Exactly.
You deal with stress better. You know, you have a libido. All matters.
Definitely. دقیقاً وقتی که شما به نقطه برسین که احساس دوران 20 سالگی رو بکنید با اون سطح هورمونی، با اون احساس، با اون حالت‌هایی که از نظر جسمی روحی در خودتون احساس می‌کنید، کی برش میاد؟ میگن که سن و ایجینگ رو نمیشه کنترل کرد. سن وقتی بالا بره، ولی به عقیده من در این دور زمان سن فقط یک عدده. اون ما هستیم که باید تحت کنترل داشته باشیم زندگی خودمون رو و در یه مسیر درست بتونیم، حتی اگر شناسنامه ها اعداد بالا میره، ولی از نظر سلامتی، از نظر جسمی، از نظر ظاهری ما نه تنها با زمان پیش نمیریم بلکه عقب گردن میکنیم. این هدف خیلی از ما نیست. I was trying to tell our viewer that everybody say, yeah, the aging, you have to look at your birth certificate, the age number, and I do believe the aging is just a number. It's important how do you feel.
Yeah,
how
it's
do you
how many
look,
years
and
you've been
exactly.
here. But inside is a different number. It's not the same number. Many people are older inside than they look.
Exactly.
Many people feel younger inside than they look. So we were going for a biological makeover. We want to make you turn back the clock so that you're 20 inside. Because 20-year-old women don't have heart disease, diabetes, cancer, depression, osteoporosis. I mean, I can go on for days.
Yes,
That was the premise.
That's a many cases. اینجا نظریه اینه که ما زمان رو میگن نمیتونیم به عقب بیاریم، ولی از نظر سلامتی بدنمون که بتونیم به نقطه برسونیم که در سن 20 سالگی بودیم، چرا نه که بتونیم این کار کنیم. و این فقط از نظر مسائل جنسی و هورمونی نیست، از نظر ناراحتی قلبی، یک به غیر از مسائل استثناها که خب دچار بیماری میشن و سن مشخصی ندارن، ولی معمولا ناراحتی قلبی، ناراحتی پوکی استخوان، آرتروز یا خیلی از ناراحتی که بر اثر ایجینگ یا بالا بودن سن در بدنها به وجود میاد میتونه کنترل بشه به این وسیله و در واقع عقربه های ساعت رو برگردیم عقب میگن. time there was a movie, they said it Back to the Clock, but they said this is just a fiction, science fiction, it's not in real life.
But I can do it in real life.
Yes.
I can prove it on day 12 and 21.
Yeah, yeah.
And years go by of people on this, and the kind of degeneration you expect to see now that we're a decade out doesn't happen.
Right.
And even with our cancer patients, the kind of outcome you would expect as a physician giving high doses of estrogen and progesterone to cancer patients doesn't happen.
Right.
They're okay. And they have this quality of life. Because, you know, having somebody tell you have so many years to live, some doctor,
Right.
you know, bedside manners, but
Exactly.
how long you have to live. And then you find out that's variable. Depends on what you do. You know, we have one cancer patient who died in 7 months, and it's been 8, 9 years on the protocol.
Right.
So you don't know what's going to happen until you try.
Exactly.
But the fear around hormone replacement stems from the Women's Health Initiative and the fact that they gave static drugs with hormone-like effects.
Static. That's
They're static,
what it comes.
and they're drugs. They're not hormones.
Exactly.
They had hormone-like effects, Premarin, Prempra.
Well, that's
And then it was in women over 65 who were always very ill. So the outcome of that study was useless and misleading.